Swoop. Here we is again. Um, we're going to talk about a couple things. We're going to talk about how your heart has a bunch of neurons in it, and that's going to be the discussion topic for this week too, because it's very interesting. I got a cool little video for you guys on that, and then we're going to talk about blood pressure and kind of EKG stuff on this little one, and then we got one more lecture, and then oh boy, I've been lecturing all day. And this has been going. Okay, so let's draw like a real simple little acorns. So this would be, of course, our right ventricle. This would be our left atrium here. With our left end. Oh boy, I look like a trash can, dog. Okay, cool. Boom, nice and easy. So let's just remind ourselves this is right atrium, right. This is right ventricle. This is left atrium, la la land. That's where I live in LA. I love having plastic surgery and being fake. And I have a lot of followers, but I'm dead on the inside. Okay, this is actually one of the most fascinating things to me. Okay, so your heart muscle cells can contract on their own, right? You have two of them in a dish, they'll start to beat. You put cardiac muscle cells on a gelatin-shaped fish, and that fish will start to swim. I mean, this stuff is crazy. Okay, and it gets even crazier because your heart has its own set of neurons. So your heart has about 40,000 neurons. It's a lot. It's about half of the amount in a Drosophila fruit fly brain, I think. Let me just Google that real quick. How many neurons does a fruit fly brain have? It's pretty crazy to know. We know this. We've counted them. About 100,000. Yeah, so you got about half. Look at me, I know things. It's almost like I have a PhD. It's about you got half of a brain of a fruit fly in there. About half the brain of a fruit fly. So if you see a little fruit fly flying around, you'd be like, man, my heart's got half of its neurons in my freaking heart. All right, and what are they doing? Well, let's draw a little brain here, I guess. We got a little brain up here. It's got a little cerebellum. It's got stuff like that. It's got its cortex, right? These are wrinkles. This part looks like a little tree, and this is a brain. Okay. And there's some neurons that go kind of down from it. Oops. And they innervate like a little cluster of neurons right here in the heart. And these kind of wrap around the atrium like so. Kind of looks like a little spider in the way I'm drawing it, and that's cool. And they also actually wrap around over here to this left atrium. All right, and this thing is called the SA node, this bundle of neurons, SA node, or the sinoatrial node. SA node, you can just know it as SA node, but that's the full name of it. This is a cluster of neurons, and it kind of extends around the atrium, and this helps regulate atrial contraction. Put that in blue. Regulates atrial contraction. All right, but it doesn't just stop there. Okay, there's another little node right about here. Okay, and then this guy sends out a bunch of neurons. And I'm going to actually make these a little thicker. come down, and then they wrap up and around, like so. They wrap up and around like so. These are called Purkinje fibers, these little things I'm drawing here. Like so. This is your AV node. This is AV node. And this is your atrioventricular node. Atrioventricular node. And this thing obviously regulates ventricle contraction. Regulates ventricle contraction to make sure they're kind of in sync, and also, like, you know, your brain, I'm not going to talk about how this works, but you can sense, you basically sense carbon dioxide here. You'll sense carbon dioxide levels. Measures the changes of pH, actually, in cerebral spinal fluid, and then that'll increase heart rate, and you'll increase breathing rate and all that stuff. This is one way that we regulate that. It also keeps these kind of in sync and working together. Okay, but maybe they also do more than that. Maybe these neurons also, do other things. You know, and we're going to explore a video kind of covering that topic. And these ones here are called Purkinje fibers. How do I spell this? I think that's right. I think that's right. Purkinje fibers. I think it's actually I think it's a name. Purkinje fibers, yeah. Okay, so those are our two nodes, and this regulates heart rate and all this jam. Kind of synchronizes contraction. Okay, and if you're looking at something like this, let's look at heart rate here. And this looks something like this. This is from an electrocardiogram, let's say. It looks a little fat there. Get rid of that. Okay, it's not bad. It looks kind of trash, actually. But you get the idea. This is an electrocardiogram. There's only a couple of things that I want you to know here. This is called the P wave. This is called the P wave. Then we have Q, R, S, and then T wave. This corresponds here. This P wave corresponds with SA node. SA node firing. It's actually what we're measuring, is the depolarization of those neurons. SA node firing. And then here we have this R wave is our AV node firing. So this would be our AV node firing. Here. Okay? That's it. That's all I want you to remember. We got the SA node first. The is this little pre-fire, and then we got the big fire, which is our AV node. And that makes sense because these are our big ventricles versus our small atria, right? It's not that hard to remember. And just some things. Yeah, let me see if I could just do this real quick. So one thing that we can get, let me redraw this. Kind of happening is we get another one. It's going to jump down. It's going to jump up. It's going to jump down again, and then it's going to jump up, and then there's another little wave. Okay. All right, so these are now really close together. I guess I should have kind of copied this other one so you could see how they're, you know, they have a certain spacing. There's so many beats per minute occurring. So this would be kind of normal, let's say. And then this is very rapid, let's say. All right, so normal heart rate, rapid heart rate. This rapid heart rate is called tachycardia. Rapid heart rate. Rapid heart rate. It's called tachycardia. Tachycardia. And if you have like really crazy tachycardia, like your heart's beating 150 beats per minute all the time and you can't stop it, what they'll actually do is they'll burn off some of these neurons. So one treatment called SVT, I believe, and it's been a while since I've actually looked into this, but to treat one treatment for tachycardia is burning off the neurons in your heart. It's pretty nifty. Okay, and this is a EKG or ECG, an echocardiogram. Echocardiogram. And the K comes from like British cardio or something like that. And that's why it's a K. I'll move that down just so make it smaller. Move it down so I can move this down and have my things be kind of neat and organized. Okay. Okay, cool. Echocardiogram. All right, that's all I want you to know about that. All right, we're talking about heart rate, cardiograms. Okay, what's a normal, I just drew a map of the United States of America. Just kidding. What's a normal heart rate and blood pressure? So normal heart rate is like 60 to 90 beats per minute, somewhere in there. Not too crazy. And then your normal blood pressure is around normal blood pressure. So this is like the force of your blood pressure. That's what that means, is 120 over 80 millimeters of mercury. That's how we measure pressure. Millimeters of mercury. All right. What the heck does this mean? Heart rate is just how many beats per minute. That's what that means. How many times it's beating per minute. It'll depend on if you're standing or sitting, if you've just exercised, but normal resting heart rate is 60 to 90 beats per minute in humans, and normal blood pressure is around 120 to 80. And like what the values here don't necessarily make that big of a difference if they're lower. What you're looking for is a difference. There's something with 2 hearts worth of neurons flying around my face. A little Drosophila melanogaster, aka a fruit fly. Normal blood pressure. So let's say I have 110 over 70. That's also totally fine. Over 70. It's also totally fine. What matters is kind of the space between them. All right, let's go through. Let's go through and talk about what heart rate actually is. All right, let's redraw a couple of little hearts. All right, let's draw a little atrium. Little guy like this. Draw a little more complex than the last time. And not spend a lot of time on here. All right, we got our aorta. And let's draw another set of these. I'll start with this guy again. What is blood pressure? What are these values? You work in the medical field, you should know this, but if you don't, you're now going to. And then we got our Okay, so 120 over 80. That's the blood pressure reading. It's essentially just two pressures. What are those two pressures? Okay, let's break this down. We got 120 over 80 millimeters of mercury. That Hg is the atomic symbol for mercury. You take mercury, you put it in something, you pressurize it, and you'll lift the mercury up the more pressure you add. And so how many millimeters of mercury you're able to push up or down tells you how much pressure you need, or how much pressure is being exerted. Okay, this here is called systolic, this larger number. Systolic, and this is your diastolic. I don't want to make that confusing with using that color, sorry. Let's do purple and pink. Systolic, your systolic pressure, and your diastolic pressure. That's what those are. All right, so what is systolic? That's when your ventricles contract. So when these contract, it's your big pressure. Makes sense. These are your big muscles of your heart that go. Okay, so it's going to cause the most pressure to occur. All right, and then this diastolic pressure is actually when these fill up. So it's the atrial filling. So these fill up and then the atriums go. That's what diastolic is. So it's going to suck blood past through the cardiovascular system or through the veins and arteries when these fill up. So it's ventricle systolic. Systolic is ventricle contraction. Ventricle contraction. It's the big pressure. And diastolic. Diastolic is atrial filling. Atrial filling. Pretty nifty. Okay, so now how do we actually measure this? Let's go old school. Let's go old school, brother. Okay. All right, so we got, let's say we got a little vein. Like so. And we got our pressure cuff around it. Like so. This is a pressure cuff. Pressure cuff. And it's low pressure. Or no pressure. No pressure. All right. Blood. And we got a little stethoscope here. Let's draw a little stethoscope. We got a little stethoscope right there. We got our little earbuds. And we listen. So we got a stethoscope. Stethoscope. That's wrong. Stethoscope. Okay. Stethoscope. And we listen. Stethoscope to listen to blood flow. All right. And we're going to do this in lab. We have little sphygmomanometers to do this as well, but you can do it with the stethoscope as well. So in this case, we got no pressure. Blood's just going to flow right through. We're not going to really hear anything. Blood flows cleanly, and there'll be no sound. You won't really hear much. Okay. Now, let's say we now pressurize this cuff so that we now close off. We now close off the blood flow, so we really hear nothing. Pressurized cuff, high pressure, high pressure. I'm not going to redraw the stethoscope, but it's there listening every time. We got high pressure, no blood flow. no sound. All right. Really not going to hear anything here. All right, then we slowly release pressure until we hear a tapping sound. So what's going to happen, we're not going to get any flow here. But here we have a slight opening every time the ventricles contract. So every time these contract, it'll be just enough to open up these. So we'll hear this tapping sound. Just like that. It's like a little vein clapping. So we've reduced the pressure here. But there's still quite a bit. Let's say it's 120. 120 millimeters of mercury pressure. And so there will be blood flows during ventricle contraction. And this creates and then it closes when not. And vessel closes when ventricles are relaxed. Okay? This causes the vessel to clap, making a tapping sound. Do, 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 do. Okay? All right, then we continue to release until the clapping stops. Continue to release pressure in the cuff until the tapping stops. And so it essentially goes right back to this state. So now it's just open all the time. The pressure is low enough. Let's say this, and you listen for when that transition occurs. What pressure does it occur at? Let's say it occurs at 80 millimeters of mercury. Pressure there. Tapping stops. Tapping stops. Pressure is low enough that the vessel stays open the whole time. That's what blood pressure is. That's how we measure it. Okay, pretty interesting. Okay, that is way too big. All right, I think that's it for this one. I don't think there's anything else that I want to cover in this one. So I think we'll end it there. It's pretty cool stuff. And like I said, this is going to be the topic. What are these neurons doing in our heart? Are they maybe doing other things? All right, one more lecture. I'll see you guys in that one. All right, bye.